So if you are new here, welcome to Chow Buddy's YouTube channel. Today's topic is going to be about blood parasites. Here at our veterinary clinic, we do in-house testing, and one of the tests that we routinely run for our patients is a blood parasite test. It checks for the presence of blood parasites like anaplasmosis, Ehrlichiosis, Babesiosis. So we check those 4 blood parasites with one single test. And if you want this test done for your pet, then ask your vet about it or ask us in the comments down below. We will provide more information so that you can talk to your veterinarian about this blood test for your furry family members. As always, this educational content is not intended to be a replacement for your veterinarian. Please contact us in the comments section if you have any questions or concerns regarding the health of your pet. We are more than happy to help guide you through these topics. But please remember that we have never examined your pet, and therefore our advice should not be taken as a replacement for your own veterinarian's medical advice. If you think your pet may be sick, please take them to their veterinarian immediately. So today we're going to be talking about these 4 blood parasites that we test for and discuss signs, symptoms, treatment options, prevention options, and everything else in between. So let's jump right into it. Okay, so first off, we are going to start with anaplasmosis is caused by a bacteria called anaplasmosis. This bacteria is transmitted to our pets via the bite of an infected tick. Now, most of the time, this bacteria is only zoonotic, meaning transmissible to humans, in the northeastern United States and in certain parts of Europe. But it is important to note that there was a case in Wisconsin back in 2018. So it is possible that it is starting to spread. The incubation period for anaplasmosis is usually about 7 to 14 days, but could be up to 21 days. Some of the clinical signs that you might see include fever, lethargy, loss of appetite, joint pain, swelling of the lymph nodes, and even jaundice. Now, most dogs will develop antibodies against the disease and recover completely. But some dogs will suffer from chronic anemia, and this will affect their quality of life. And there are rare cases of death due to complications of Ehrlichiosis is caused by a bacteria called Ehrlichiosis. Like anaplasmosis, Ehrlichiosis is also transmitted via a tick, but this particular tick is known as the brown dog tick. The incubation period is anywhere from 2 to 3 weeks. Clinical signs of Ehrlichiosis are variable, and in some cases there may not be any clinical signs at all. Some dogs may show signs of fever, lethargy, anorexia, bleeding gums, and even there are 2 forms of Ehrlichiosis. One is the acute form, which is usually meaning that your dog's immune system will fight it off without any intervention, and the dog will make a full recovery. The chronic form is much more severe and can cause damage to the immune system, the kidneys, the liver, and even the heart. This form of Ehrlichiosis can be fatal and has a higher mortality rate. Thankfully, Ehrlichiosis can be treated with antibiotics and supportive care from your veterinarian. Also, there is a vaccine available to protect against the acute form of Ehrlichiosis. This vaccine is not very common, but it is recommended in areas where Next up, we have Babesiosis. Babesiosis is actually caused by a parasite called Babesia canis, and it is transmitted by the brown dog tick. This parasite is closely related to malaria, and if you have ever heard of malaria before, you know that it is a very serious and potentially fatal disease. Well, the same thing can be said about Babesiosis. Clinical signs include fever, weakness, lethargy, anorexia, as well as hemoglobinuria is basically when your dog's urine turns red because there is a high concentration of hemoglobin in it. That means that the red blood cells have been damaged and are releasing hemoglobin into the bloodstream. And then the hemoglobin is being filtered out by the kidneys and excreted into the urine. The definitive diagnosis of babesiosis is made by finding the parasite on a blood smear. Treatment includes supportive care and possibly blood transfusions if the anemia is severe. There is also a drug called demonazania citrate, which is used to treat babesiosis. However, this drug is not approved for use in dogs. And lastly, there is no vaccine available for babesiosis. The last blood parasite that we test for is Hemobartonella felice. Hemobartonella is caused by a bacteria called Mycoplasma hemophilia. This bacteria is transmitted by a tick and also by the bite of an infected cat. This blood parasite is most common in cats, but it can also infect dogs. Clinical signs of infection include fever, weakness, lethargy, as well as anemia. The diagnosis is made by finding the bacteria on a blood smear. Thankfully, Treatment with antibiotics is usually very effective against and there is also a vaccine available to protect against Hemobartonella, and it is included in the feline leukemia vaccine. Now let's talk about how to prevent blood parasites. Blood parasites are everywhere, and it is almost impossible to keep your dog away from them completely. However, there are things that you can do to lower the risk of infection. First and foremost, if you live in an area where blood parasites are prevalent, we highly recommend year-round prevention using a veterinarian-approved product such as NexGard, Bravado, Simparica, Trifexis, or any other similar products. In addition to these oral medications, we also recommend that you put a barrier between your dog and ticks by using something like Frontline Plus or Advantage 2 as a topical medication. And if you are really worried about blood parasites, then you can consider giving your dog a vaccine. Vaccines are available for anaplasmosis and for both of these vaccines are administered by injection. You can find the vaccine combination that includes Hemobartonella under the name FVRCP. Now, if you think your dog may have a blood parasite infection, then contact your vet immediately. Early diagnosis and treatment are key in preventing any long-term complications. Blood parasite infections can be very difficult to diagnose because the clinical signs are so not. Many times blood parasites can mimic other diseases such as immune-mediated hemolytic anemia, canine infectious anemia, and even Therefore, if you notice any signs of blood parasites, please contact your veterinarian immediately so that they can perform the appropriate tests and get your pet on the road to recovery. Now, we have created a downloadable one-page document that summarizes the main points of today's lecture. Hopefully, this video was informative and helpful. Please leave any questions or comments down in the comment section below, and we will respond to every single one of them. Thank you guys so much for watching, and please stay tuned for more health-related content for your pets.